call the Monroe County Women's Commission to order. The Women's Commission shall serve in an advisory role to assist residents, businesses, and the government of Monroe County in addressing issues of gender equity, period. The mission is to advance the status of women and marginalized genders in all areas of county life. And I am Maria Douglas, the vice chair. And I am facilitating this meeting because Susan, our chair, is not in attendance. In attendance in person, we have, or no, do we have anybody on?
Molly was going to join on remote.
Molly Otto was going to join. I don't, on Zoom, I don't see her. We have Jennifer Belton in person. We have Tiana Iroge in person. We have Kathleen Sobiak in person. We have Julie Hardesty in person. And we have a guest from the City of Bloomington's Status on Women Commission, Patty Moon. All right, moving on. Is there a motion to approve the agenda? And before we make a motion, I want to make, an addendum, a change?
Have something to add? Yeah.
I want to add, after my update, I want to add just a general commissioner's update or time to make announcements or updates, because you guys do things in the world and I want to give you guys the opportunity to tell us about them, not just Susan and myself.
I will second that.
Thank you. Motion passed. So we're moving on to approval of minutes.
We still need to approve the agenda.
Oh, she passed my addendum. So do we have a motion to approve the agenda with the addendum?
Yes, I motion to approve it. Is that what I'm supposed to say,
Yeah.
right? Okay, yeah, I've been out of, touch. Sorry.
A little out of practice, a little
Yeah.
rusty. Thank you. And then we'll move on to the approval of the minutes for the May 16th meeting. First of all, a thank you to Secretary Julie Hardesty for the thoughtful and detailed meeting minutes, as always. Can I have a motion to approve the minutes from the May 16th, 2024 meeting?
Making a motion to approve the minutes.
A second.
Thank you.
Should probably do like an all favor.
Oh, yeah, I forgot. This is my first time running this meeting, you guys. So all in favor, say aye, aye.
Aye. Aye.
No, I said aye, aye.
Aye.
Okay,
Captain.
Like,
If Molly joins us online, we'll probably have to move to roll call, but I don't think she's there yet. So.
thank you. Okay, so since Susan is not here, no, she did not have any updates. So my updates are as follows, as per usual. Happy Pride Month. Happy Alzheimer's Awareness Month. Today is World Refugee Day. And happy day after Juneteenth. And we are sending Susan, our chair of this committee, healing vibes. Some things that I wanted to bring to as my updates are, I attended, we haven't talked about this really, but I wanted to bring it up today, just letting you know that I did attend the People's Market community conversation on May 26th. if you want details on that, I can go into details later, maybe, in this meeting during our profile time. If not, though, I do want to say that everything, meaning money, meaning services, meaning programming, meaning mission, is for me not in question. And grants come and grants go for whatever reason the state and funders decide on a whim for whatever reason. And I don't, ever all the documentation and the financials that were provided and are live on their website. That meeting is live on their website for anybody to see. It all makes sense to me. So I personally continue to support the People's Market. I also attended the Indiana Youth Institute June 5th convening on mentorship. It was held at the warehouse, and that was very insightful. Talking about sponsorship versus mentorship, the importance of meeting students, especially youth, where they are. So that was interesting. And I'm mentioning that because I attended on behalf of the Women's Commission when they asked for organization affiliation. I also want to update Middle Way House's status. I spoke with a shelter, I believe she's a team member of the emergency shelter. I spoke with her on, what day was the? This past Saturday at the city's Juneteenth celebration, and she assured me that the emergency shelter is open and almost full at this time. So I was very happy to hear that. On another update on that, I am in the process of working with Community Justice and Mediation to have a facilitated conversation about transparency of services with Middle Way House. And my last thing includes Patty. So what needs to be done if for the Women's Market taking place on July 27th? Patty, do you want to introduce yourself and then say if you have information about that? And it's okay if you don't.
This is very fancy for me doing the microphone situation. I'm Patty Moon, and I'm here on behalf of the city's commission. As Maria mentioned, Shayla couldn't be here today, so I'm filling in. We do have the Women's Market coming up on July 27th at 9, running until 1 in City Hall. I believe that a lot of the actual planning has been completed by our staff liaison already, but I know that she just sent out a request for volunteers. Again, also when I say planning, it's pretty a pretty relaxed setup, just with vendors representing women across our community. But she did just send out a call for volunteers, and I will ask her to share that with you all. We're having people being able to come in and set up the day before, and then people coming to set up in the morning. So there are volunteer shifts the Friday before, in the evening time, and then I believe in 3 small time increments on Saturday. But that's all I'm aware of at this time. I can also ask Marissa to reach out again.
That's great. Thank you so much for that information. And just as serving as a liaison for between the two commissions for this meeting, can you ask what is the status on the kind of co-branding situation?
I know that she sent out the flyer asking for people to register as vendors before that situation was finalized. So that's why that flyer or graphic that went out did not have the co-branding. But as far as I know, we have not sent out the official flyer graphic. I have not seen that yet, but Marissa said at our last meeting that it would also have the county logo and the County Women's Commission on it.
Okay, very good. Thank you. Thank you, Patty. All right, so that is all for me for that, for my updates. So as I added to the agenda, the commissioners' comments, this is your time to make announcements or updates. If you have any, no pressure because you didn't know. But is there anything that you want to amplify?
Well, we're going to have an update with the outreach committee. So, but and I think we're going to have a vote to approve a date and an event for a health fair. So it's very exciting. That's going to be something that we'll go into more detail about when we get to our subcommittee update.
Right. So thank you so much. That's exciting. So anything outside of the subcommittee updates?
I do have a few. So I was just listening to the Monroe County Health Department board meeting, and they just approved a position for a maternal and child health. They're not sure what it's going to be called, but coordinator, like somebody specifically to organize around that topic. Including finding out what the situation is within the county and surrounding counties, what exactly, are barriers to care. So that was really encouraging. The Monroe County Health Equity Council, they are still hoping that we can have some more community conversations. The Bloomington Hospital that period has closed for surveys and information that gets fed into the community health improvement plan, but the county is still willing to collect data if anyone wants to host a conversation. We have meeting in a box materials. I didn't realize that the meeting itself is set to run about an hour and a half for up to 8 participants. So if you have ideas for, like if you have a church group and you think, oh, that would be a great setting if they were already meeting, if we can add on to that meeting, we could probably get snacks. There have been a lot of community meetings already. So there's been meetings at the Banneker Center, at Fairview Elementary. IU has kind of gone, so we would just like cross-check what they've already done. But certainly if you have smaller interest groups that you can think of, elderly population, I think there haven't been a lot of conversations with elderly folks. So just to get your wheels spinning on that, I wanted to, they're saying deadline maybe by the end of July for those conversations. And I could help host, and I have a person that's willing to like co-facilitate if no one at the location wants to do that. Or we can send you the materials for you to host it, from somebody from the organization. I also want to mention that Jennifer and I are co-team leaders for Women's Build. This is our 4th year as a team co-lead, so we would love it if anyone wants to join us. Our build day is on Friday, September 20th. No experience necessary. The Women's Build model is that everyone agrees to fundraise $300. It's almost like a microfinancing system because we're actually raising the money to build 2 homes. And for the kickoff event, we got to meet one of the women that's going to be living in one of the houses. She's a single mom from Colombia. So she gave just a beautiful, heartfelt message to all of us, just how much it means to her that she gets to participate in building our own home, that her son Liam can look to her and just with pride at how much she's accomplished being a single mom here in a new country. And this was all in Spanish, and she had a translator. She's already put 230 sweat equity hours into the process. There's a very rigorous process you have to go through to get to this point of getting a Habitat house built. So we're building an Osage community behind RCA, and there's already many Habitat houses back there. So it's really something cool to be a part of. So I can send out the link to the group, and then if you want to join.
When is the deadline to join up? With your group or someone else's group?
Yeah, you know, they don't really put a deadline on it. It's kind of more, the fundraising deadline is probably the beginning of September because they need those funds to be making the construction purchases. So going backwards from there, you want to give yourself time to raise the money. Some people can afford to put some of the money in themselves. We'll also do like bake sales. Jennifer is already organizing 2 bake sales where our team raises money, and people that are struggling with the $300, we always say don't let the $300 prohibit you from building with us, because we'll get you there. We'll get you to the 300. We always do. Do you want to add anything to that? Any other questions? Yeah, so. Okay.
Thank you so much for those opportunities and for doing that work, for sure. I have a question about the meeting in a box. I did attend the one at Banneker. Can you remind us what the outcomes are, or what their goals are for having these conversations?
They're going to do a qualitative data analysis, and IU Health Systems will incorporate all the feedback into their health improvement plan, which they have to redo every 3 years. So it'll help them select priorities. That deadline is over. That was June 15th. But the county also does a community health improvement plan. I think they call it a community health needs assessment. And so they're still collecting information. So the conversations will get collected with all the other data for kind of priorities to bubble up. You know, if people are mentioning, because the questions are all about barriers to healthcare, to access. So it might be like transportation is a huge issue, or, you know, some prevention or preventative care. So they use that to inform policies for the next 3 years.
Very good. Thank you. And yes, please get the links out for your build.
Yeah, I can do that right now, actually.
Does anybody have anything else that they want to say, update, announce? Okay. Go. No? No?
What announcement? Oh, just personal announcements? Any announcements?
Just anything.
Oh. I guess I could make an announcement.
I mean, no pressure.
Clearly none. So you all know, I did today turn in a petition to run for the school board, Monroe County Community Schools. So that's something that I will be doing. My name will be on the ballot in November. I can't take a picture of the ballot and send it to you. You know, you don't let you bring phones in. Ruth reminded me of that. So yeah, so I'm excited to see what happens.
Congratulations.
Yeah.
All right.
Thank you for stepping up for that huge
Yeah.
lift and service. Yeah.
Mm-hmm.
Super excited about that. You'll bring so much.
Yeah, I'm excited too.
Yay.
A little nervous, maybe?
Yeah,
You sound a little nervous
it's
too.
It's a little unknown, so I'm reading
Yep.
rampantly. I mean, I
You got
turned
it.
everything in today. I probably signed the last document the second time at 11:52.
Oh my
when
gosh.
noon was the deadline. I mean, I had to rush from my office. She was like, "You got to sign this." I was
It was
like,
on
"Okay."
time.
And I had to hitch a ride. I didn't have my car today. Had to hit a ride, but I got here. So
You made
no.
it happen.
Yeah, so I'm
And
excited.
therefore, you will be a good school board member.
Yeah, another way to serve the community.
That's
so
right.
I'm looking forward to it.
Yay. All right, anybody else? All right, we'll move on to old and ongoing business. So the first subcommittee that we hear from is the Profile Subcommittee. And the purpose of this committee is to elevate the profile of the Monroe County Women's Commission, letting the county know who we are and what we support and what work that we do. And we do meet usually every, second Thursday of every month at 5:30. And no, we do not have quorum at these meetings. There's only 3 members of these subcommittees. So we did not meet this month, just so we know. But I do have an update. County Councilperson Crossley announced that we were partnering with the City of Bloomington's Commission on Status of Women for the implementation of the women's market. And Councilperson Crossley said that this is an example of county-city collaboration. So thank you to Councilperson Crossley for updating, saying that during the liaison updates. I also want to prepare for public comment, updating council and commissioners on what we've been working on, what we are working on. So I'm asking the other subcommittees members or any member, really to submit updates. So just to email me so I can put together using the template that we created, put together the public comment for us to review and then to vote on and then to say. So that's an action item. We'll move on to any questions, comments about.
Yeah, I was actually going to ask, do we want to do that as a public comment, or do we actually want to ask to be added to the agenda to report at these meetings? Because I think that is, as a commission, as a county commission, I think that's a thing we can do, right? To request to be added to the agenda to give a report, which might give us a little bit more time, and you're not like restricted to 3 minutes and that sort of thing.
Okay.
I don't know.
We can do that.
I don't know what the timing is to request to be added.
Yeah, we could do that. And then if for some reason we can't get on the agenda
Yeah, you could
in
still
a
public
timely
comment.
manner, then we could, thank you. And then we can just adjust
Yeah.
to the public comment. Yeah, good. I like it. Anything else about the profile subcommittee? All right, we'll move on to the outreach subcommittee. And the purpose of this committee is to create and maintain programs that support our mission. The current focus is the web design camp, and then I believe another opportunity that we have that Julie spoke about earlier. They meet on Mondays, not on an as-needed basis. So whoever wants to report out for that.
We met as a committee, and we met as a committee. We have secured a location for the Women's Health Fair. We have secured a date, and we would like to vote. It will be if it's approved, it will be at the Banneker Center on September 28th from 8 to 11. And that is in partnership with IU Health. We'll host it. They'll come in and do the work. They will provide blood pressure screenings, A1C screenings, and lipid screenings, all free of charge. IU Health will post it in their monthly bulletin, and the Banneker Center will post it in their monthly bulletin. We did have some anonymous donors to donate the fee for the Banneker Center, so there's no fee for us.
Very nice.
Good, because we don't have any money. I'm just, we don't have no money.
So that is our update. Did I miss anything?
Yeah, I was gonna say, is there things that we as members of the commission can do, like be there for the event or?
If you want to come in and come show support, like it's 2 hours.
Get your blood pressure taken?
Get your blood pressure taken, get your A1C checked, get your lipids checked. It is fasting, so that's why we have it so early in the morning, so people aren't going all day without food. Spread the word. Oh, I do have a flyer. I did not bring it. It's on my work computer, and I will send it out, but I would need that approved. The sooner the better, just so we can promote it and get good promotion. Now, what I ask of you guys is if you guys want to have others join, I'm okay, whatever. We have the whole space, so.
So, yeah, I think we're probably going to have a couple of things we need to vote on then. So
Yes.
if we want to vote to approve sponsoring this event on September 28th from 8 to 11 at the Banneker Center, and then also if we want to, this will get us the ability to get the flyer going. If we want to approve whatever the subcommittee thinks is good for the flyer for the event, that way we can just, once it's ready, we
Sure.
can get it out the door.
Yeah. Yeah. So do I do that right now then?
Yeah.
Okay, thank you. Okay, so do I have a motion to approve the Women's Health Fair sponsored by the Monroe County Women's Commission and IU Health at the Banneker Center on September 28th?
I'll move to approve.
I'll second.
All in favor? Aye, aye.
Aye.
Thank you.
Good work. Oh my gosh, that's really exciting.
That's my signature.
So if
Not just
we
an aye.
can get, I don't have these connections. I'm kind of throwing this out there, but like snacks and food, like after people, because they've been fasting, if we have
Sure.
like extra things that we can maybe get from the community.
Does IU Health bring any?
Yeah, we bring swag.
You do bring snacks or just?
No, just swag.
Oh,
like,
okay, so snacks might be something.
First aid, little kits, COVID tests. Oh, I'm sorry. We will do flu and COVID shots there also.
Oh,
My bad.
Wow.
I forgot that.
Maybe I'll see, I can see if one of the student orgs or department in the Luddy School could help sponsor snacks
Yeah,
and let you all know. I'm sure that's possible.
Yeah, I think our MPH students would also like to either be there and help, or maybe we could do something else. Definitely, I think that would be really cool for them to be involved. If people asked, if a male wanted to come, it's open. I'm questioning, would that be
Open.
okay?
It's open
Okay.
it's open to anyone who would like to get their A1C lipids checked.
Okay.
I would definitely like to target to our group.
Yeah, we'll call it women's, because we're, right?
I don't know,
Women's
man.
health
That might
fair?
be discriminatory. I'm being facetious.
Okay.
Maybe we'll just call it a health.
No,
No,
women's. She
women's.
wants it.
Okay,
yes.
all right, we'll do it.
I'm going to say, we've
I'm
already
for it.
approved it as
Okay, oh, it's already
women's.
approved. It's done.
Done deal. I was just asking, and people ask.
Anybody is welcome.
asked, yeah.
Anybody is welcome,
Yeah.
but I will definitely, on my behalf, target all women of all aspects of all socioeconomic status. That's my target.
Yeah. I was going to ask, because I'm sure IU has experience and you have experience with this, making sure people understand they have to fast the night before. Is it because it's on the flyer? Like, how can we help reinforce?
So it's going to be on the flyer, and then IU Health is it's their little standard blurb of
Yeah.
free, and they say, make sure you're fasting for
Okay.
accurate results. I think that's what the blurb says, if my mind is serving me right.
Okay.
But the flyer that I have will have all of that information. And we just got it's no longer a venipuncture, it's now a finger stick for both. So, which makes it easier. So people don't have to get like a for real blood draw.
And then you go on to IU to see the results?
Yes, you
okay.
will go on to IU to see the results. If your blood pressure is high, we will call you the Monday. If your A1C or your lipids are elevated, then you'll get a letter in the mail. And then someone will reach out to you to try to get you funneled into primary care. Also with the blood pressure readings, they will try to enroll you, which I think is great, into a program where they'll send you out a blood pressure cuff, and then you'll get a text message saying, hey, check your blood pressure, and that automatically uploads to your chart at IU Health. So your provider can see the trends of your blood pressure.
Awesome. I'm wondering if they do they do any thyroid checks? Okay. I didn't know if that's become more advanced because so many women suffer from that without knowing it.
So my future goal is for next year is to have a mammogram. There's a little red door come down
That'd be
because they
great.
do free mammograms.
Okay.
But it's definitely going to be, I think they only limit it to like 20 people.
Yeah. So it's,
But it will
minute
be
to
a
do those.
sign up.
right, register
Put
first
your
or
stuff in,
something. That'd be
first 20
great.
people, and they bring their little bus and they set it on the street. You get your mammogram and
What a service.
figure it out.
So
And
good.
then I guess I can connect with your group for more of the details, but just to gauge your interest. The School of Public Health has this veggie meter, and it's a machine, and it can tell you if you're eating enough vegetables. They like to bring it to fairs and stuff.
Can we have that?
Is
Okay,
anyone
we'll
ever
ask for
eating
that.
enough vegetables? No one is ever eating
feel
enough
like
vegetables,
every-
right?
I don't know,
One
but it's
goes,
kind of
"No."
interesting, and the faculty are really
Except
great
for Patty.
that run it. And then also we have smokealizers where like you blow, if you're a smoker, you blow in and you see a carbon monoxide reading, and then there's a chart of just like, I mean, something like that, and then somebody to educate just on like, the quit line and something like auxiliary services like that. Okay.
That would be great if you could
I
get
can
that.
check on
I would love that.
Okay.
So we also need to get the vote for approving the subcommittee to get the flyer out.
Thank you.
Yeah, don't want to forget about that.
Thank you, Jennifer, for making this happen. It's so important. So do I have a motion to let whatever the subcommittee, outreach subcommittee approve the flyer? Do I have a motion for that?
Yes. Do I need to repeat? Yes,
No.
I motion to let the subcommittee design and approve the flyer and go ahead and send it out.
That wasn't verbatim, but that's okay. No, I'm just kidding. I'm totally kidding.
I second.
Thank you. All in favor, say vegetables.
Vegetables.
Okay, good.
Remember I said that is not Robert's rules.
Is
So
that
can I
Robert's
give a,
rules? Yeah.
so I do have a quick update. So I did just send a message to Molly about the web design camp, but as I sent that message, we already had a message from the IU General Counsel. So they would like to meet with Luddy to get some more information. That meeting will happen. Look, it's not their delay. I will own it. This could have happened before I left for Ghana. However, April was the busiest month of my life at work. She sent this for April, and both my boss and I ignored her. So I just followed up with legal counsel while I'm sitting here in this meeting because I saw this on the agenda. And we're going to get on it. We will get information, whatever information they need, we'll get it going. And all they want to know is our involvement, and it'll get approved quick. They move really fast. So I own it. We're going to move fast, and we'll get it going because we're going to have our camp this upcoming fall.
Okay, thank
So
you.
that's
Thank
the
you.
update, and I will own the delay. Sorry about that.
Thank you for all of that. And when you say our, you mean Luddy?
So
Luddy's involvement?
yes, Luddy's
Okay.
involvement is what they want to know. So
Okay.
I have to help Paul. Paul is the person that's
mhm.
representing Luddy, not me.
That's
I
right.
represent us.
Yes.
And so I just got to inform Paul and IU Legal, as in my job component, what's going on.
Got it. Thank you.
Yep, thanks for that. But that's the clarity. Yeah. No double dipping.
No double
No
dipping
double
here.
dipping. No.
Mm-mm.
I want to, the policy subcommittee, I think is that, oh, it's been switched around. Never mind. I'm sorry.
Remember
You're
last time
good.
I asked for it to be switched around so I
did.
wasn't talking for a full 45 minutes straight?
Did it work?
Yes.
Okay.
I mean, kind of, but also I will always talk, I feel like. Okay, so, yeah, I see. Yeah.
No problem. We appreciate it.
I mean, I know. So going to the policy subcommittee, which is the purpose of the policy subcommittee is to evaluate county policy using gender equity lens. Current focus is the jail. And we are also working on a gender equity rubric. And so that is one of the updates for this committee, is that we have begun research on existing gender equity rubrics, and we meet every fourth Thursday of the month. So that's next Thursday to discuss our findings and what our next steps will be. We also sent, Julie, do you want to update on that? On the IRACs? Did we already update on that?
We updated, yeah, we updated on that.
That we got a
We had a
response?
response and
Okay.
we followed up on that, I'm pretty
Okay,
sure. Let me
okay.
double check the notes, but I think that was in there.
And just an update for everyone here, there's a new location being looked at, which is West Hunter Valley Road and West State Road 46. They did contract, I believe, with Vet Environmental Engineering for Phase 1 environmental site assessment.
You know what, I don't think we did do, that's not in the notes from last month. I think all of that has happened since.
Yeah.
Oh, the IRACs?
Yeah,
Okay.
get the survey response, yeah.
Okay, so Julie, if you can
Remember?
give the 20 or less on why what we did pertaining to IRACs.
Yeah, we surveyed the 5 counties that are in the pilot program for IRACs in Indiana. We put together a short list of questions asking them about how the program is going in their view, and particularly in terms of marginalized communities and women. We also asked about recovery organizations that are being used, if they have a recovery organization they can identify, and then if the program is going to be continued. So we received one response, and I don't remember the county. We received a response from one of the counties. I think it was the sheriff that responded. Essentially from that county, we're hearing that even though it's been 2 years, there's really still not enough data to know, not enough information to know if it's making an impact on recidivism. So there's still not enough information in this pilot phase to understand what kind of impact the IRACS program is having. But I do think that it is continuing. It's essentially what we were hearing from them is that it's state money is funding the program, and as long as the state is willing to continue funding the program, it's going to continue in their county, because it's helpful to have that. It's helpful to have those resources, so they're going to make use of them. And they did identify the recovery organization. I don't know if we are wanting to reach out to that recovery organization that they identified or not, but that was one of the things we were contemplating, is if we wanted to continue the conversation somehow with whoever the recovery organizations are that are identified. But so far that's the only response out of the 5 counties. So small response. Not sure if it's necessarily helpful for what may or may not happen here, and what we would want, if we want to recommend anything, what we would recommend. But yeah.
It seems to me that we could Well, I don't know. You're the researcher, Kathleen. Like, what, we had one response, and could we also probably say that 2 years is not enough time for anybody, any county, to get data? Or no?
I mean, if this is following a national model, is there other data from, yeah. And I'm sure they have to be tracking some data. I mean, if you're talking like population level data, then no. I mean, I'm sure their sample sizes are very small of who they're working with.
Yeah, there was something interesting. It wasn't super clear. There's someone we can contact if we've got more questions too. So we might actually want to do some follow up here. But basically, what I think we were told was that they can't really say for certain with their particular county, but they said overall across all of the programs. So I think maybe across all 5 together, they are seeing a recidivism improvement. So maybe there's something like that, but I don't quite know. There were no numbers, so I'm not quite sure where that's coming from. It's anecdotal. So
and I know I've seen. I wanted to say also IRAC stands for Integrated Reentry and Correctional Support. So in case you're wondering what IRACS was, I also wonder about just anecdotal testimonials, because I have seen a sheriff from a jail, I forget which county he was in, but he was at the NAMI, the National Alliance for Mental Illness, NAMI Indiana conference. They do a conference on criminal justice, and he was there with the lead for the IRAC program in his jail. And so they worked so well together, but here was this formerly incarcerated individual, and they were like working as a team now to help support people in jail. And he had gone through the program and is now a peer supervisor. So like, when you hear stories about it, I'm not sure if it's showing up in the data. I would think it is, because his story was just amazing. And then he also was telling stories of just how he has an effect on people that are incarcerated right now and how much the program means to them. So it's one of those things where also qualitative, with the small sample size, qualitative data would be useful to hear stories. Yeah, I know you're concerned
Thank you
about
for that.
Yeah.
And I think we talked about, because we don't know, IRACS has to choose Monroe County, and we don't know a deadline or when we're going to know or anything like that. And with the turnover in commissioners, that also, because it was Penny Gibbons, I believe, that brought that proposal. And so with her not being a commissioner in 2025, I don't even know if that will be on the table. So I feel like we'll just kind of hold with what we're doing until we hear further about that about IRACS. But that's what we've just our report out of what we've done up until this time. Any questions, comments about the policy subcommittee report? All right, that moves us to the data subcommittee. The purpose of that committee is to become more grounded in who we serve through data. And they also meet as needed. And that is Susan Hingle and Kathleen Sobiak. Do you have anything to update?
This will be short. We have nothing to report. I think once, we should probably set, I'm going to like own up to it. We need to set meetings, I think, rather than having it on an ad hoc basis. So hopefully by next, I can't even say it's going to happen by next meeting because we've got some recovery time to consider. But I think, we'll get a system going. And if you have particular data needs, let us know. But our original plan is just to do a landscape of So we do have a spreadsheet going, and it's kind of, the goal is to just keep on populating that. So maybe a thing I can do by next meeting is share out that spreadsheet, maybe populate it more, and then you can see where it's going and have it in mind if you have additional resources that our team can add. It will be a repository. So I'll do that by the next meeting.
Thank you.
Okay.
Thank you.
I just kind of talked myself through that process.
It worked.
Made perfect sense.
Yes.
I love
Yeah.
the modeling of taking accountability, and then that just,
Yeah,
you just modeled how that happens.
yeah.
Okay. All right, public comment. All right, seeing none. Oh, we have public comment. Please come to the table and
Do.
identify yourself. You live in this room.
You're our ex officio.
You live in, I know, I told her she could come up.
Good evening, women. Wow. I'm Jennifer Crossley, your liaison. And I just wanted to take an opportunity to say that I'm really proud of you all and the work and the exciting news of folks running for office. This is great. And I also just wanted to, each of you all have, in your special way, have reached out. I know I've been absent for the first half of the year with some unexpected back-to-back losses that I've experienced. So I thank y'all so much for support and sending thoughts to myself and my family. I'm really excited about the Build, the Women's Health Summit or the health fair, excuse me, that's coming up. And I do think, and going back to a comment that was mentioned about you all giving updates to the council also has a part on the agenda for department heads, and I don't know if this necessarily qualifies
That's what I was
for
thinking of,
that.
yeah.
However, what I do think that we can do is I can ask for clarification to see if that is a simple ask for y'all to be put on the agenda. So I think that is definitely something where we just need to figure out if you would qualify for a department head update or a spot on the actual agenda, because doing something in public comment when you are a part of, the county government and whatnot probably wouldn't suffice, and y'all have been doing a lot of work, so you should probably give us a nice little detailed update. So I definitely think of that. And then, so this is all good news for me to give my report on Tuesday when we have our meeting. Lastly, I would like maybe to speak offline because and taking off my county counselor hat and putting on a hat of, and I can't speak for my sorority, but I will say, and speaking of one of the biggest things that we do, so if you don't know, I'm a member of Alpha Kappa Alpha Sorority Incorporated, and we do something like one of our committees is called Uplift Our Local Community. And one of the biggest things of our organization is we are to be a service to all mankind. So that includes everybody. So in terms of snacks, I would like to maybe speak and see what we can do to help and assist with that as well. So I know we do a lot of chip bags for Banneker Center where we give out bags for students who might not have access to food over the summer, so we drop those off at the Banneker Center, and then the Banneker Center will go about and we'll disperse those. So I think that this is something that we could do, because we also are trying to get more active and involved with a lot of missions and organizations within the community. I think that is also something that I can do. So taking that hat back off and putting the other hat back on. But I just wanted to say that I appreciate the collaboration with the women's market and the city and all of the good discussion that I've heard here today. And I will be back next month. Yay. So sorry for my absence, but I've been in here in spirit and I've read things, the minutes and everything virtually since I have not been in attendance. But as long as there is nothing else that comes up, I should be here. But I appreciate y'all. Thanks y'all for doing the hard work.
Thank
We
you so
appreciate you.
much.
Thank you so much
Thank you.
for being here today.
I kind of want to add to what she was saying. If it sounds like that might be something like an incentive, if there were like, come get your screenings and there's, they get to leave with some sort of incentive, like in addition to just having a snack there, but like things that they can take home. I don't know if that's a food bag or what, but
They will already give out blood pressure cuffs if your blood pressure is elevated.
so.
I mean, that's not an incentive, so
Yeah.
high blood pressure.
This is so great. So exciting. Good meeting.
Do I have a motion to adjourn?
A motion to adjourn the meeting.
A second.
Yeah.
Aye,
Adjourn. Thank you so much.
aye.